Welcome to Healthy Frontiers. My name is Dr. Bizzoni. I'm a chiropractor, and this show is dedicated to the education of our viewers. The special topic for tonight is pediatric physical therapy with Cuevas Medic exercises. My special guest is Maura Gordon. Let me tell you a little bit about Maura. Maura is a licensed pediatric physical therapist specializing in treating medically complex children. In 1992, Ms. Gordon graduated from Columbia University's College of Physicians and Surgeons with a master's degree in physical therapy. She has worked in pediatrics ever since. Ms. Gordon spent 8 years working at the Elizabeth Seton Rehab Center, where she was promoted to chief therapist. This experience provided an excellent grounding for understanding the needs of medically complex children. Ms. Gordon has also worked in schools, daycare centers, and private homes. In 2011, Ms. Gordon attended a beginner-level seminar on Cuevas Medic exercise, or CME. That experience dramatically impacted Ms. Gordon's treatment methodology and clinical outlook. Ms. Gordon decided to pursue additional CME training directly with the technique's founder, Raymond Cuevas, at the CME Center in Santiago, Chile. She spent extended time in Santiago to complete her intermediate and advanced CME training. This unique experience makes her a much sought-after pediatric therapist. Currently, Ms. Gordon is one of a handful of Level 3 CME therapists living and practicing in the United States. Ms. Gordon opened the Metamorphosis Pediatric Physical Therapy Clinic in 2016 and continues to practice CME almost exclusively. The clinic is located at 336 Route 202 in Somers, New York, right here in Westchester, and is wheelchair accessible and very family friendly. I'd like to welcome Maura to the show.
Thank you for having me.
Welcome, Maura. So we're going to start off by asking you what's the difference between pediatric physical therapy and how does it differ from regular physical therapy?
Yes. So with regular physical therapy, you have an individual, a child or an adult, who has been proficient and physically capable in their lives, and they have sustained some sort of an injury, an illness, or a heart attack or a stroke, and they've lost capabilities. So you have an individual that remembers how they used to be, and they are working to get back to that point.
Yes.
So they know the end game, they know that they have skin in the game to reach that goal, and they generally have the cognitive or the intellectual capacity to understand why they're going through sometimes a very uncomfortable process to get to that point.
Right.
Even with all that knowledge, it can be quite difficult to get a typical patient to really participate fully in their program. But then you look at the pediatric patient, and now you have, in the type of child that I treat, which is, say, the child with cerebral palsy, Down syndrome, severe prematurity, these children have never reached full proficiency.
Yeah.
They may not have ever learned to sit, they may not have learned to walk, or maybe they walk, but a puff of wind knocks them down, they can't handle gravel, they can't handle stairs. They don't know what being physically competent feels like. So you're working to help this child advance to a goal they've never experienced.
Right. Okay.
On top of that, particularly the young child or the cognitively limited child, they may not have a sense of urgency or a sense of need. They're perfectly happy with where they're functioning.
Right.
So they don't really understand why they're being put through any
All
kind of
this-
uncomfortable paces. And
Yeah.
a lot of times they're not either at an age level or a cognitive level where you can verbally explain it to them.
Sure.
So you've got to approach these patients and find a way to get through and get them to work and get them to cooperate with you.
Well, I'm sure you got to bring the parent.
You bring in the parent, you bring in whatever you can.
Right, to get them there. And
Yes.
typically, what age did some of these children start at? Is it way young or?
Younger is better so that they don't have a chance to develop habits that interfere with further development. For example, you can have a child who has learned to get around their house by scooting on their back.
Okay.
They're happy, they're mobile. They don't want to learn to roll over and get up and crawl. They're happy how they are. So earlier is better to forestall that. But that said, my patient population runs from a few months old up to age 15.
Wow. Okay. So when we talk about Cuevas Medic exercise, so how do Cuevas Medic exercises, or CME as it's called, differ from traditional pediatric physical therapy?
Okay. It's profoundly different. In a nutshell, the difference is between facilitating steps in the gross motor milestone chain versus provoking postural writing reflexes. Now that's a mouthful.
Yes.
So, so let me explain
that.
Traditional therapy, what we are taught in the schools, is a technique called NDT. That stands for neurodevelopmental technique. What we do with that technique is we look at the child and we say, where are they on the gross motor milestone chain? And in a nutshell, that is, you roll over, you develop your belly skills, maybe you crawl on your belly or pivot in a circle, you sit up, you get up on hands and knees and crawl, you pull up to standing, walk holding on, and then walk freely.
Yeah.
So you look at where that child is in terms of their development, and then you're going to look at what you need to do to bring them to the next step up. So they may need a little stretching out. If their muscles are tight, you can decide maybe they need a little strengthening, and there's tricks to strengthening a very young child. And then you use your hands, you lay your hands on their body over the muscle groups that you consider the most primary in getting the next movement that you want, and you kind of manipulate and pull and push those muscles in a way to help the child perform the activity. That is NDT. It's a great technique. It's very carefully thought out, and it is what I practiced for 15 years.
Right.
Enter Cuevas-Medic exercises. There's some assumptions that Cuevas-Medic exercise practitioners blows the lid off of. One, there's really no reason to believe that a child with a brain injury or a child with an atypical brain genetic anomaly, there's no reason to believe that they are going to gain their skills best in the same manner as a neurotypical child. Yeah. And if you think about it, it makes sense. We don't, if a child is hard of hearing or has no hearing, you don't teach them to communicate using the same strategies as a hearing child, but this is the assumption that we as therapists are trained to make.
Right.
So if you're not going to teach them in the same manner as a neurotypical child, what do you do? Well, Ramon Cuevas in the early 70s came up with a technique to provoke what are called postural writing reflexes. Okay. These are reflexes in the body, we all have them, that serve to help us remain upright and stable in space.
Right.
And his idea was that, look, these are delayed children, and the end game is really to get up and walk and be energy efficient and upright.
Sure.
Why not just go for that? And is the limiting factor for the child strength or flexibility? Probably not. You don't have to be that strong or that flexible to move. Perhaps it's something else. He developed this method of stimulating the postural writing reflexes, which are reflexes of the type that say if you're walking down the street, right?
Yes. Yep.
Minding your own business, you hit a patch of ice, you're not expecting it. Your body performs a whole series of movements totally instinctively that keep you upright if you're lucky.
Right.
Or riding a bike, same thing. Or suppose I toss you a ball, you're standing and you think it's a 1-pound ball, it's a 10-pound ball.
Yeah.
Your body handles that for you. You can't practice it by rote. You can't sort of discreetly agonize out each individual movement. You just respond. It's a big global movement. And that is what Cuevas-Medic exercises are about. Let's get that big body response out of the patient.
Great, great. So, all right, so let's go to what special training do CME therapists receive?
Okay. There are 3 levels of CME. Level 1, 2, 3, which is basically beginning, intermediate, and advanced. At each level, you're taught 2 things. You're taught a series of exercises. And by the time you're a level 3, you have learned just under 250 different activities that you might pull into a session. Yes. And then you can also adapt those activities as needed. But you also have to train yourself as a therapist, because if you're trying to get these postural writing or recovery responses, you don't get to hold the patient by their torso. You don't get to hold them by their hands. You have to free their body up as much as possible, so where, say, a child doesn't stand, traditional therapists might assist that child holding their hands. They might hold their waist. I might hold that child by one ankle. I might actually put them on top of my hands, or I might put them on a surface that I can manipulate and just keep them upright in space. As they are falling, I'm catching them without actually touching their body.
Yeah, sure.
And in order to do that, the second component of being a CME practitioner is you have to train your own hand-eye coordination and reflexes, and there are specific activities that as a therapist, as a trainee, that you do in order to do that. You balance all these objects on top of themselves.
That's amazing, amazing. And you went to Chile, Santiago, into Chile just to learn this from the founder, right? Mm-hmm. Right, so you got it right from the horse's mouth.
I went, the first course that I took was in Brooklyn, New York. Mm-hmm. He taught it. I was very lucky that he teaches 1 or 2 courses a year anywhere in the world, and this level one happened to be in Brooklyn, New York, and I went. Right. I was tremendously impressed.
Yes.
But I don't know that I would have ended up pursuing traveling all the way to Chile. Mm-hmm. Except for I have this belief in life. There's a saying: when the student is ready, the teacher is there.
Yeah, love it.
And what really pushed me to the next level was I had a relatively new patient on my caseload, a little microcephalic child. Mm-hmm. Okay, that's a small brain.
Yes.
And just rigid muscle tone. She was stuck in basically a chair sit position.
Right.
And she was only a few months old. And with my MDT hat on, I'm going, okay, we need to stretch you out, lengthen you out, and get you over on your belly, get you started. If I touched this child, she would scream and stiffen up even more.
Yeah.
So I was at my wit's end.
Sure, sure.
I said to her mother, you know, I've learned this new technique. I haven't really tried it, but it would be another avenue in. Can we give it a go?
Yeah.
And this child, it took a while, and she had a significant medical condition, significant physical symptoms.
Brain injury, brain damage.
She was walking fluidly and independently by just a little over 2 years. Wow. And I knew without a shadow of a doubt that had I approached her as an NDT practitioner, she might have made it to walking with a walker. She probably would have been in a wheelchair.
Yeah. And now she's walking.
Mm-hmm. Yeah.
That's tremendous.
Yeah. I knew because I knew my own work, and I knew.
Well, you went out on a limb too, and yes, the parent went out on a limb too. Said, yes, give it a try.
Yes, it's very hard. It's very hard to put aside everything you've done for 15 or so years of practice and go, we're just going to try something completely different.
Okay, so what made you decide to pursue advanced CME training, and especially since it involved traveling abroad?
The traveling to Chile, anybody watching this that thinks I had some sort of trust fund or it was a big decision. I was heavily influenced by a family who was, for level 2, for my intermediate training, who was taking their child there for an intensive setting. They said, you can stay with us, we'll help you with expenses. I went, and what I saw them doing in that clinic changed me forever. It changed me forever. The classroom situation was amazing enough. I saw things, I saw children perform in Ramon's clinic in ways that once you see it, you can't look back. I had a moral imperative to continue that training.
That's great.
Yeah, I had to do it.
So let's talk about some of the medical conditions that CME trained practitioners actually treat.
Okay. CME was first created specifically for the child with cerebral palsy.
Okay.
And that is a great patient population because if you look at, say, a child with spastic quadriplegia, or where all 4 limbs are affected, or a child with diplegia, just the 2, a lot of times they're kind of rigid and stiff, and we spend all this time stretching them and strengthening them, but really, a lot of times they can take their weight and stand, but you let them go and they just fall over like a tree. So the technique is very good for teaching those individuals how to keep their own balance. Once you can stand in balance, you can walk. It might take a little more work.
Sure. Okay.
The interesting thing is if you look at the flip side of the spectrum, the child with Down syndrome, say, who is a very low-tone, floppy, hypermobile, loose-limbed, and those children also benefit from CME because for whatever reason, something within the technique that stimulates out those postural reflexes firms them up and helps them become more coordinated, nimble, quick. For example, it used to be such a struggle to get a child with Down syndrome to crawl. They just don't have the stability through their hips.
Right.
I don't even work on crawling anymore. They all crawl. They just do. All
Wow.
of them.
That's
All of
amazing.
them.
That's great.
It's incredible.
That is incredible. Any other conditions or?
Yeah, most conditions, I found that the child who's just sort of a little off, I've been seeing some of those kids lately where they're just a little clumsy, they're not keeping up with peers. And sometimes 5 or 6 sessions, boom, they're done.
Yeah.
They're functioning much better and they're discharged, and that's a lot of fun. The only conditions that are really problematical are maybe the child with fragile bones, because it's
Yes.
a very vigorous technique.
Yes.
Or a child with a degenerative neurological condition. You want to be careful about stressing them too much, like
Right.
muscular dystrophy.
Right.
But everybody else, if you're feeling a little stuck with your child's progress in therapy,
Yes.
you want to give it a try.
That's great. Okay, so what are some examples of the unique benefits of CME?
So, as I alluded to earlier with what is the difference between the pediatric
Yes.
client and the adult client,
Yep.
you don't have to actually have an intellectual understanding or necessarily cooperation. This surprises the response out of the child.
Yeah.
So they don't have to understand what's happening. In fact, if you get the parent in there and you kind of keep them distracted, you wave toys, I use M&Ms,
Right,
whatever
whatever.
it takes.
Yeah.
I can pull the performance out of the child, and because it's honing up the reflexive response system,
Yes.
there's great carryover into daily activities. So
Yeah.
you don't have to have a child who agrees to what's
Yeah.
going on. It just kind of happens. It's kind of happenstance. You don't have to spend time with stretching and strengthening, because one, the child is probably already strong enough to perform the activities they're struggling with.
Right.
And even if they're, they probably are, but if they're not, it's a vigorous technique. And with the stretching, the more dynamic the child becomes, the more they lengthen out their own muscles.
Sure, sure. Do you, I'm sure you have to work very closely with the medical profession and other alternative care professionals, right? Do you see a lot more referrals coming from that group? Did the medical doctors even know about this Cuevas technique?
Well, that's on me.
Yeah.
That's on me. I do provide some in-services when I
Yes.
get around to it.
Okay.
And I really enjoy it, and I need to do it more because 100% of the doctors that see an in-service see the video footage, because I've got
Yes.
video footage of kids, are blown away. I think
Yeah.
this technique needs to be more out there. They cannot, especially if it involves some of the children that they also see. They can't believe that kids can do
Right.
what they do in the
Well,
sessions.
it's great for hopefully a lot of
Primarily-
medical doctors will see this and
Yeah.
actually, question it at least and say as an alternative to what they've been doing.
Yes,
know?
I'm happy to provide in services. This is a
Yeah.
technique that needs to be better known.
Is it done in hospitals at this
It
point
is
at
not.
all?
There are very few therapists that progress past level 1.
Right.
The bringing the technique out into the world in general, there are only 2, I think now 3 people who are allowed to teach the technique, and that is Ramon Cuevas himself. He's based in South
Sure.
America. He doesn't get here often.
Yeah.
Another therapist that's based in Canada, and I think they just certified another one. So almost no one is teaching it. It's a class of 25 people. They'll cut how many students there can be because you need a lot of hands-on attention.
Right.
And
Yeah.
not too many people are crazy enough to travel to
Yes.
Chile.
No, I got
But if you can, it will change your life. It will change your life.
I
The
understand.
getting people trained, it's not an easy technique to learn. Getting people trained is challenging.
So I have another question then. Okay, so is it covered through insurance at all?
Sure.
Is it like under the physical therapy
Yes,
umbrella?
yes. It is simply another form of therapeutic exercise
Okay.
or neuromuscular reeducation. So yes, as long as you have your physical therapy license, it's 100% covered, depending on
No, I understand.
your
Yeah.
own insurance
Yeah, that's great. Okay, 'cause
allowances.
I think a lot of
Yes, no, it's a
those looking at it-
legitimate, recognized technique.
Perfect. Okay, so let's just get near the end here about ask you about your practice. Why don't you just tell us a little bit about your practice, and if I walked into your door, what would happen if I had a child that was challenged?
Okay, so a lot of times we'll have a phone conversation beforehand. You can have a formal evaluation if you want one.
Yes.
I don't really need to do that. It's pretty easy to
sure.
right in the moment see what
And
we
I would
need
think
to do.
medically, excuse me, I'm sorry to interrupt,
Sure.
but I would think that they would already have their diagnosis by the time they get to you from their medical world,
Yes.
right?
Yes.
So now you
Yeah.
go ahead. I'm sorry.
So I think, you know, many people that come to me have already been through a number of facilities.
Yeah.
What's different about me, one, is there's parent participation. I don't have an office where the parent sits in the waiting room and who knows what happens behind the closed doors.
Right.
I think some of those parents should go behind that closed door and see what's going on.
For sure.
But in this case, the parent is an integral part of the therapy to keep the child amused, help keep the child distracted, and they can see. They get to see with their own eyes what's happening
Right.
with their child, and they love it. They love being sort of empowered to be a part of it.
Yeah.
The other thing that I know as a mother myself that a lot of parents struggle with is you don't often just have a disabled child, you have other children.
Right.
I can manage, I have my office set up so that the kids can all come in.
Right.
There are toys to play with, there are things to do. They want to try an activity, they can try an activity too. I can integrate the child, the siblings into the session, and when I have a reluctant patient client,
Yeah.
if big brother or little sister does the activity too, that only helps.
Sure, and that's what they're going home to, right? They're going to be
That's
home.
right.
You know,
That's
so
right.
they
That's right.
get a taste
So
right there.
It does take some stress off, and it's also it's just a friendly environment. Everybody, it's so isolating for families when they have a child with a disability.
Yeah.
These people all know they all know each other.
Yeah.
I got little Johnny running out to tell little Susie, I did such and such,
Yeah,
and then
For sure.
dragging little Susie in out of the waiting room, going, now this is a nice little visit we're having, but it's time to go. So I think people really like the bonding experience and the interaction with other families.
Oh, that's terrific.
I wanted that, and I think I did it. I'm happy about that.
That's great. So you've been in practice up in Somers since 2016, and hopefully many years to come.
Yeah, I
And
hope I can keep going. I wish I could have a do-over of my first 15 years of practice. I
Yes.
feel that strongly about it.
Yeah. Well, I just wish the best for you, and I'm sure the audience has learned so much tonight about this particular type of physical therapy. And I want to thank you for being on the show tonight.
Well, thank you for having me, and thanks for all the great work that you do.
No, thank you, Maura. Pleasure, and I heard the greatest things about you as well. So thank you. Okay. Look to see you on the next show, and I want to thank the audience for being so attentive tonight. Thank you.